Hi everyone, it's Nicole again. I'm the community advocate from Lifespin, and today we are going to be talking about the extended health benefit, which is a benefit that is available through Ontario Works slash ODSP for people who are coming off social assistance for a variety of different reasons. Let's get right into it. So, what is the extended health benefit? The extended health benefit is provided to recipients who have high prescription drugs or other health related costs, but are no longer eligible for income assistance due to income from employment, business income, or other income sources like guaranteed income supplement, old age security, EI, Canada pension plan. So if you were getting OW or ODSP income support, but are now coming off because you have other income, you may still qualify for one of these health benefits from Ontario Works, the extended health benefit or the extended employment health benefit. I'm more going to be focusing on the extended health benefit today because I do get a lot of questions about health coverage after the age of 65. So the most important thing about the extended health benefit is that in order to receive it, you must have been on Ontario Works or ODSP in the previous month that you started getting your other income. So for example, if you started receiving your old age security and guaranteed income supplement on September 25th, you must have been on Ontario Works or ODSP in August 25th or in the month of August to be able to receive this benefit. Recipients who qualify for the extended health benefit may receive the following health benefits if they meet eligibility criteria: prescription drug coverage, vision care for dependent children, dental care for children age 17 and under whose families are residing in a First Nations community, diabetic supplies, surgical supplies and dressings, medical transportation costs over $15 per month, consumer contribution for an assisted device and eligibility assessment under the assisted devices program, batteries and necessary repairs for mobility devices, and routine eye exams every 2 years. So who can get the extended health benefit? If the only reason you do not qualify for income support is that you have excess income from other resources or sources, you might be able to get the extended health benefit from Ontario Works. You may be eligible if you are over the age of 65, you are awaiting ODSP determination, are not eligible for Ontario Works because your income exceeds the requirements, you have been removed from ODSP due to your earnings from Canada Pension Plan disability. So how is the eligibility calculated? Well, the rules say that you have excess income when the total amount of your income from other sources after exemptions and deductions allowed by OW is more than your entitlement. Some examples of income from other sources are earnings from a job, self-employment, business income, or EI benefits. Under OW rules, you can earn up to $200 a month without having your financial assistance reduced. This will not be accounted when OW calculates your income. Your entitlement is the maximum amount of income support you could get from OW for a month before they made any deductions. The amount of your entitlement is shown on the left side of your OW/ODSP check stub. Example, a single person has a monthly budgetary requirements of $733. Their chargeable income is calculated at $730. Their eligible health costs total $250 per month. Their budgetary requirements and health benefits equal $983 per month, which exceeds their available income of $730. So the person will continue to receive the extended health benefit. or they not continue to receive, but they will receive the extended health benefit if this is the case. So how is eligibility calculated? There are 3 steps to figure out whether you are eligible for extended health benefit. First, you should determine how much your excess income is. To do this, you need to know your total income from other sources for the month after the exemptions and deductions were allowed by OW. From this amount, subtract your OW entitlement. If the answer is more than 0, you have excess income and cannot get income support, but you might be eligible for the extended health benefits. Add up your eligible monthly health-related costs. The costs I listed in slide 3 are eligible. Compare your eligible monthly health-related costs to your excess income. If these costs are more than your excess income, you may be eligible for the extended health benefit. You can keep getting the extended health benefit as long as your eligible monthly health-related costs are higher than your excess income for the month. While in receipt of the extended health benefit, you are required to report any changes in your circumstances to support ongoing eligibility. Cases are reviewed monthly. Figuring out whether you are eligible for the extended health benefit can be complicated. So the next slide will detail some of my recommendations if you are interested in applying. If you are able to, follow my steps on slide 6. If you are not able to, or if you completed step 1 and are still unsure, follow step 3. Next, ask your OW/ODSP worker if you qualify and provide them with all necessary documents such as notice of assessment, pay stubs, pension, documents detailing your monthly entitlement. If you are not comfortable with asking your caseworker or your worker does not get back to you, please come to me and I will contact your worker on your behalf with your documents ready. What is not covered by the extended health benefit? Mandatory benefits including guide dog, full-time employment benefit, other employment and employment assistant activities benefit, and advanced childcare. Discretionary benefits are also not covered except for health-related discretionary benefits that are issued under the extended employment health benefit, but only during the first 6 months of your new employment. Important things to know about the extended health benefit. If you are eligible for the extended health benefit, you must present your Ontario health card to a pharmacist along with your prescription. The health card allows the pharmacist to verify that you are eligible for coverage under the Ontario Drug Benefit Program. Direct payments to the recipient or service provider can be made as appropriate. The health costs must be verified prior to issuing the benefit. This would mean you would have to obtain receipts for how much you're paying at the pharmacy for your medicine, or at least give a written estimate. Members of the benefit unit who do not have an Ontario health card can use other forms of government identification. These include a driver's license, Ontario Work Statement of Assistance, Ontario Photo ID card, or a passport. Please visit the ministry's website down below for a complete list of approved types of ID. What if I do not qualify? Well, if you don't qualify for the extended health benefit, you may be eligible for help with your prescription drug costs under the Trillium Drug Benefit Program. This program provides coverage for prescription drugs through the Ontario Drug Benefit. Discretionary benefits can cover most health-related costs as well. If you do not qualify for extended health benefit, you might qualify for the extended employment health benefit, which covers the same costs as just the normal health benefit shown on slide 3, but this would only be if you got off social assistance because you were starting a new job. If you are refused or cut from extended health benefits, ask for the decision in writing immediately. You can appeal to the Social Benefits Tribunal. The Social Benefits Tribunal is independent from Ontario Works and has the power to cancel Ontario Works decisions. But first, you must write to the OW office that made the decision to refuse or cut off the benefit and ask for an internal review. So I will touch on briefly on the employment extended health benefit. And this is a health benefit through Ontario Works for people who are employed. A person who is in receipt of income assistance such as OW or ODSP and due to starting employment or having increased earnings are no longer for OW or ODSP is eligible for the employment extended health benefit if they meet all other conditions of eligibility for income, except the condition that their budgetary requirements exceed their income, their assets are within the allowable limit and participation requirements, they're exiting OW or ODSP because of employment income, they are not eligible for the extended health benefit, and the benefits payable under the employment extended health benefit are not recoverable. Partially or completely under a benefit plan available from an employer. If it's like, let's say if you are only eligible for dental coverage through your employer plan, you would be eligible for all other benefits through the extended for the employment extended health benefit, except for the dental coverage, which makes sense because if your employer is going to cover the dental, you don't really need extended health benefit to cover the dental. But you would be eligible for all other benefits. So who is eligible for the employment extended health benefit? There's no limit on the number of times the employment extended health benefit can be issued for a 1-month period for recipients who periodically temporarily exit Ontario Works or ODSP due to fluctuations in earnings. If you are ineligible for financial assistance for 1 month only, then no further assessment is required. However, if you remain or are expected to remain ineligible for financial assistance beyond the first month of ineligibility, then a full assessment must be conducted to see if you're eligible for these extended health benefits. If the client is subsequently determined not eligible for the extended health benefits, their eligibility for the employment extended health benefit in the first month remains unaffected. A person is eligible for the employment extended health benefit on the day they become ineligible for income assistance. A person becomes ineligible for this benefit after 6 months on the last day of the 6th month. Example, if a person is ineligible for income assistance in January 2017, eligibility for the employment extended health benefit begins on February 1st, 2017 and ends on July 31st, 2017. A recipient is considered to be in their first month of ineligibility for financial assistance when they have income in excess of their budgetary requirements for the month in question, and that income includes earnings from employment, operating a business, or from a training program, or if you were eligible for financial assistance in the month prior. How long can you get the employment extended health benefit? You can get it for up to 6 months, but let's say you lose your job over the 6-month period and you do not qualify for Ontario Works, you would likely still be eligible for the employment extended health benefit for the 6 months to continue and continue to. Yeah, you would be able to get it for at least 6 months as long as you continue to meet other eligibility criteria. Okay, important things to note about the employment extended health benefit. Effective January 1st, 2018, prescription drug coverage for individuals 24 and under who have an Ontario health card is provided by the Ministry of Health and Long-Term Care through the OHIP program. Recipients who are eligible for EEHB but do not have an Ontario health card will be issued monthly drug cards by a designated Ontario Works partner for the first 6 months. However, the extended employment health benefit may be provided for an additional 6-month period if the administrator is satisfied that not providing the benefit may be harmful to the health of a member of the benefit, may jeopardize the employment of a member of the benefit, and if the benefits are not provided under an employer health plan. So additional coverage. During the 6-month period, recipients are no longer eligible for drug coverage. Help with drug coverage in the second 6-month period is limited to assisting with the quarterly deductible costs of the Trillium Drug Plan if the employer does not offer a drug plan. Recipients continue to be eligible for other health benefits as provided during the first 6-month period if not made available under the employer plan. I know that this slideshow was kind of a mouthful and it's really complicated to understand, but my number one piece of advice to you would be if you are turning 65 and you want the extended health benefit, um, after you start receiving your pension, would be to send in your pension documentation to your caseworker. So after you do your pension, you'll get a letter from Service Canada telling you how much you're going to be receiving a month. You would then send that to your caseworker, and it would be up to your caseworker to make the calculations to see if you would be eligible for the extended health benefit. That is what I would do personally if I was in this situation, because the calculations can be a little hard to do. Um, it's certainly doable, but someone may require a little extra help, which is totally understandable. So that's why I just recommend going to your Ontario Works or ODSP caseworker, because it's their job to make those calculations and to see if you are eligible for other benefits if you're leaving social assistance. Here's my contact info, guys. If you have any questions or concerns, please do email me. As always, I've put the Jot form link at the bottom here. If you would like an appointment, I do recommend, if you want an appointment, to fill out this intake form. If you do not have internet, please call us and we'll book you an appointment. Thank you so much for joining. I hope this workshop was informative for you guys, and I will see you again at the next one. Bye bye. Take care.